Good morning, good afternoon, good evening, everyone. Welcome to today's class. I'm going to be your presenter for today. My name is Paul John F. Mudlong. A registered nurse. I'm currently working as a um, intensive care unit nurse at FAU NRMF. So the teaching strategy that I'm going to be using for today's class is the use of visual aids and jobs, and as well as lecturing. Okay, let's move on. So for today's class, we are going to be making sure that we obtain or attain these five learning objectives as we go along. So the first one would be define key terms related to infection control, such as aseptic technique and pathogen. Second would be explain the importance of hand hygiene in preventing the spread of infections. Third one would be demonstrate proper hand washing techniques according to the CDC guidelines. Number four, evaluate the effectiveness of isolation precautions in reducing nosocomial infections. Number five would be develop a training program for healthcare workers on infection control measures tailored to specific healthcare settings. And I just want to make sure that as we all go along this class, if you ever have any questions, please make sure to write it down and we will make sure to address them after this discussion, okay? All right, let's move on. Hospital infections are primary cause of unnecessary deaths in hospitals. So millions of preventable hospital infections cause unnecessary deaths according to the CDC, which is the Center for Disease Control. All healthcare providers worry about organism transmission. Asepsis helps achieve this. So asepsis means it is the state of being free from living pathogenic organisms. So infection control addresses factors related to the spread of infections within the healthcare setting. So it's going to be it's either patient to patient, from patients to staff, from staff to patients, and among staffs. Infection control also includes prevention via hand hygiene or hand washing, cleaning, disinfection, sterilization, and vaccination, surveillance, monitoring or investigation of demonstrated or suspected spread of infection within a particular healthcare setting. So either surveillance or outbreak investigation. And of course, management or the interruption of outbreaks. So let's define these key terms. So pathogenic microorganisms proliferate and invade bodily tissue, causing tissue harm and disease. The invasion and multiplication of microorganisms such as bacteria, viruses, and parasites, those are not normally present within the body. So an infection may cause no symptoms and be subclinical, or it may cause symptoms and be clinically apparent. An infection may remain localized, or it may spread through the blood or lymphatic vessels to become systemic or body-wide. So microorganisms that live naturally in the body are not considered infection. Okay, remember that. So for example, bacteria that normally live within the mouth and intestines are not infection. So as a nurse, we all know that there are bacteria and bacteria that are present in our digestive system, our intestines, and in our mouth. So those are not considered as infections. So infection prevention policies and practices are used in hospitals and other healthcare facilities to reduce the spread of infection. So what is infectious diseases? So infectious diseases kill the most people worldwide. Germs cause infections. Germs are microscopic organisms found in air, soil, and water. So germs can spread by touching, eating, drinking, or breathing. Kissing, sexual contact, and animal bites transfer germs. Vaccination, hand washing, and medicines can prevent illnesses. So we're gonna tackle all of those things as we go along. Okay. So four main kinds of germs. We do have a bacteria, a fungi, a virus, and a protozoa. So there are different types of infection. The first one would be primary infection. Initial infection with an organism to host constitute primary infection. While secondary infection is when in a host whose resistance is lowered by pre-existing infection, a new organism may set up a new infection. Okay. Third one would be local infection. Infection that is limited to a defined area or single organ with symptoms that resemble inflammation. So, for example, that's as we all know, inflammation, redness, tenderness, and swelling. So those are symptoms of inflammation. Type of infection as well is systemic infection, infection that spreads to whole body resulting into septicemia. Acute infection, it appears suddenly or lasts for a short time, and then a chronic infection may occur slowly over a long period and may last for months to years. Okay. Iatrogenic infection, infection resulting due to therapeutic and diagnostic procedures. Nosocomial infection, this is, as we all know, as hospital-acquired infection. Is an infection that is contracted from the environment or staff of a healthcare facility. So chain of infection, the presence of a pathogen does not mean that the infection will begin. For infection disease to spread, several necessary steps will occur. So these steps are known as chain of infection. Okay, an infection will develop only if chain remains intact. These are the links. So these are the links. So need as we discussed a while ago. So if any one of this is not present in the chain of infection, the infection will not be could not spread. Okay. So as discussed a while ago, an infection will develop only if chain remains intact. Okay. So causative agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host, and it goes on and on. So it's like a chain. So that's why we call it a chain of infection. Okay. Next one. So we're gonna be discussing um, each of each of the chain. From the first one will be the causative agent. So the causative agent is the pathogen, such as bacteria, virus, fungus, or parasite that causes infection in a susceptible host. So characteristic of a causative agent vary widely in their characteristics, including their ability to survive in the environment, their mode of transmission, and their virulence. So their ability to cause disease. That's what virulence means. So examples of causative agents include the bacteria, which is Staphylococcus aureus, Escherichia coli. So I'm not used to pronouncing E. coli. So I'm just pronouncing it E. coli all the time. So viruses, influenza virus, hepatitis virus, fungi is examples are Candida albicans and Aspergillus species. Parasites would be malaria parasite. Intestinal worms, those are parasites. Okay, reservoir, a host which allows the microorganism to live and possibly grow and multiply. Humans, animals, and the environment can all be reservoir for microorganisms. So, as we all know, every animals they have a causative agent or a microorganism that live and possibly grow. So, as we all know, the COVID they have an idea on how the COVID spread. I think, if I'm not mistaken, correct me if I'm wrong, class. Okay, I think they said that it came from a bat in China. So yeah, next one, portal of X, path for the microorganism to escape from the host. Examples would be blood, respiratory tract, when you cough, or when you sneeze, and mucous membranes. Maybe an open lesion, a wound, okay? Genitourinary tract, through the UV, gastrointestinal tract, which is from the feces or from the stool, from the poop, and then transplacental pathway from mother to unborn infant. So that's well, when you call when, for example, a mother delivers a baby, so that's a pathway, transplacental pathway. So the infection move from the mother through the placenta to the unborn infant. Okay. Next one, mode of infection. Since microorganisms cannot travel on their own, they require a vehicle to carry them to other people and places. So infectious diseases and even certain contagious diseases spread through the following agencies. So these are the mode of transmission, their mode of infection. So first one would be airborne precaution, contact transmission, direct or indirect, vehicle transmission, either through water, milk, food, vector transmission. These are those with the mosquitoes. So they have a vector that will pin your skin. Placental transmission. So as I discussed a while ago, it's from the mother who delivers a unborn child. So the microorganisms makes way to the placenta. Portal of entry. So a path for the microorganism to get into a new host. These are the common portals of entry. So respiratory tract. So as we all know, the COVID. Pathogens can enter through the the nose and mouth, often via inhalation. Examples include the flu and the COVID-19. Gastrointestinal tract pathogens can enter through the mouth via ingestion of contaminated food or water. Examples include norovirus and salmonella. Genitourinary tract pathogens can enter through the urinary and reproductive systems. Examples include our STDs or STIs, sexually transmitted infections like gonorrhea and chlamydia. Number four, broken skin. Pathogens can enter through cuts, abrasions, or puncture wounds. Example include tetanus, okay, and staphylococcus infections. Mucous membranes. Pathogens can enter through the mucous membranes of the eyes, the nose, the mouth. Example includes herpes simplex virus and conjunctivitis. Okay. Next one, susceptible host. Okay. A person susceptible to the microorganisms. There are several factors influencing susceptibility. Okay. So number one would be age. As we all know, infants and elderly individuals often have a weaker immune system. Infant, as we all know, they are still growing, so not a lot of their immune system are fully developed. For elderly, since they are on their advanced age, most of them are with pre-existing comorbidities or they have a weaker immune system already. Uh, Next one would be immune status, immunocompromised individuals. So these are those individuals who are already immunocompromised. Immunocompromised means that they have a weaker immune system because of pre-existing conditions like here with HIV, AIDS, cancer patients undergoing chemotherapy. As we all know, patients who are undergoing chemotherapy, they are um, all of the cells may be good or bad cells. They are being targeted by chemotherapy. So transplant recipients, as we all also know that, are more susceptible. So chronic diseases, conditions like diabetes, chronic respiratory diseases, and cardiovascular diseases can increase susceptibilities. As we all know, this what I said a while ago. If you have pre-existing comorbidities or if you have chronic conditions like the one that I mentioned a while ago, it can increase your susceptibility to infection. Nutrition. So as we all know, poor nutritional status can weaken the immune system as well. Genetic factors. Certain genetic predispositions can make individuals more susceptible to specific infection. Lifestyle and behaviors. So if you're a smoker, you're alcoholic drinker, a lack of sleep can affect immune function. So as well know, if you do not have plenty of sleep, your immune system could get weaker and you're susceptible for infections. Next one, environmental factors. Living conditions such as overcrowded housing or poor sanitation can increase the risk of exposure. So, as we all know, because if you will go to a different area or areas that have um, how do you call this? On the we call it in the Filipinos like in the um, yung mga poor housing projects like the payatas and all of those tondo. So they have poor sanitation and poor overcrowded housing. So it's gonna be risk for exposing to a lot of microorganisms. Okay. Next one would be so we all know how the chain of infection works. Now we can discuss how to break the chain of infection. So, as healthcare professional, as nurses especially, we cannot provide healthcare services without some exposure to potentially infectious materials, but we can prevent transmission in many cases. So, that's correct. Breaking the cycle is the only way to prevent infection. So, breaking the cycle, breaking the chain, that's the only way to prevent infection. Health personnel must follow protocols to prevent and control infection. So breaking chain of infection. So breaking chain number one of infection. So rapid and accurate identification of organism. So routinely send blood cultures, urine cultures, and skin swab, throat swabs, and fecal aspirate cultures. Send endotracheal tube, urinary catheter kit, and central light before culture after removal. So we could eliminate the chain number one of infection if we do these things. Next one would be control or elimination of infectious agents, including proper cleaning by water and mechanical action with or without detergent. So we do have disinfection, sterilization of contaminated objects, high-level disinfectants like activated glutathione or Sidex 2%, sodium hypochlorite 1%, carbonic solution 5%, bleaching powder 1%, and there are low-level disinfectant as well, which is methylated spirit 70%, betadine solution 10%, and Savlon 1%. So how do we break chain two of the infection of the chain infection? First would be measures to control or eliminate of reservoir of infection. Reservoir. One would be employee health, immunization of health care personnel, example hepatitis B vaccines. As we all know, before we are allowed to work on a hospital as a nurse, we are required to have at least 3 doses of hepatitis B vaccine, right? And a booster for follow-up. So regular checkup for early detection of any communicable diseases, we all have that. Restriction from work of patient contact when infected with communicable disease. And then environmental disciplining with hospital. So this is a continuation of breaking chain two of the chain of infection. So environmental disease, cleaning with hospital approved clear disinfectant, examples phenol, uh, thorough cleaning, sorry. This is thorough cleaning of the bed and bedside equipment before admitting new patient. Separate mops should be used for cleaning of unit. So that's twice a day. Damp dusting should be done. Drain should be patterned. And then handling of linen. Keep bed sheets dry and clean. Change sheets every day. Do not shake blankets and linen. Of course, if there's a lot of microorganisms on the blankets and the linens, if you shake them, they will spread. Do not throw them on the floor. Soiled linen counting should be done in a separate place, not on the bedside. Okay, we're still going through breaking chain two of infection, pest control. So measures to be taken to avoid their entry into unit. Example is proper cleaning, sealing, and draining. Patients' diet should be kept in covered containers. In FAU, we do have our uh, patient's diet or authorized feeding on a cup, and there's a sealed plastic on it. Keep fly trappers on each bedside of patient if it's an open area like ward or on a public hospital where the windows are open, so it attracts flies and other insects. So yeah, pesticide spray should be used weekly. Okay, visitors control. Traffic should be restricted except for healthcare provider. Allow only one attendant in 3 to 4 hours. Keep the doors and windows closed. Cell phones should not be allowed inside the area. Machines such as X-rays, echo machines, ultrasound machine from outside should be cleaned with spirit before their use. So yeah, like us in the ICU, we limit we limit relative from coming inside all the time. So we do have a specific visiting hours for them. Um, and yeah, we are on an air condition, so most of our windows and doors are always closed. And we only allow healthcare provider to basically go in and out of the area. Actually, not in and out, but just within the vicinity. So we also eliminate nurses to go out and in and out all the time because we need to make sure that the ICU and CCU are always clean and um, the spread of infection should be controlled. Okay, breaking chain three of the chain of infection of the portal of exit. Practice aseptic precaution. Avoid talking directly into the client's mouth to avoid droplet infection, of course. Infected healthcare professionals or dealing with the patients who are infected must wear masks. So during COVID days, we have masks and as well as goggles or face shield, right? Urine, feces, emesis, and blood must be handled carefully. Avoid waste and infection by wearing disposable gloves. Breaking chain four of the chain infection. Contact precautions. One patient room, hand hygiene, gown, apron, gloves before entering the patient room and before interacting with patient or surroundings. Okay. Remove gown or apron, gloves, and perform hand hygiene after leaving the room. Remove non-disposable articles from patient's room and disinfect. Number two, droplet precautions. So one patient room, staff must wear surgical mask when entering room, remove them when exiting, and wash their hands. Instruct patient about respiratory hygiene and cough etiquette. Only allow medical necessary patient mobility outside the room and leave room with a surgical mask. So you need to make sure not to remove your surgical mask while inside the room. Okay. Next one would be airborne precautions. So single negatively pressured room. Um, Door remains closed. Staff to put on N95. Usually these are for those patients who have active TB. So those are airborne precaution. So staff to put on N95 or people mask when entering patient room and remove and dispose of masks and perform hand hygiene after leaving the room. Instruct patient about respiratory hygiene and cough etiquette. Patient to put on surgical mask when leaving room. All right. Next one would be breaking chain five of the chain of infection, which is the portal or entry. So maintain integrity of skin and mucous membrane, of course. Prepare position of tubing, etc. May prevent injuries and skin breakdown. Okay? Training and positioning of debilitated clients, correct? Ensure the personal hygiene of client regularly. In ICU, yeah, you do that. Proper disposal of contaminated syringe and needles. So we do have a proper disposal system. Proper handling of catheters and drainage. Shit, okay. Care should be taken while collecting and handling specimen, of course. Now, moving on, taking chain six of the from chain of infection. So protecting susceptible hosts. Protecting the normal defense mechanism by regular oral hygiene, maintaining adequate intake, encouraging deep breathing exercise, encouraging proper immunization of children and adult alike, and as well as for nurses, encouraging us to get immunization, such as hepatitis and then flu vaccine. Next one, maintaining healing process. So promotion of intake of well-balanced diet, okay, containing essential protein, vitamins, fats, and carbohydrates. Institution measures to improve appetite of patient, helping the client to identify methods to relieve stress. Okay, as we all know, um, we need to have a healthy, balanced diet in order for us to heal. For example, especially those who are, um, the patients that are in your area. So you need to make sure that they have balanced diet so that they could, their body could adjust on giving the best healing possible within uh, their immune system. Next one. Okay. We go on with universal standard precaution. Standard precaution is a set of precautionary measures comprising appropriate hand hygiene practices and use of protective barriers during routine patient care by healthcare workers. Standard precaution contains following things. So hand washing, that's the golden rule. Gloving, gowning, mask, protective eyewear or cap, and shoe cover. So we all have that in ICU. So we have a shoe cover, we have a mask, we have a protective eyewear, we have a gown. We do hand gloving most of the time, and we do regular hand washing. So your 5 moments for hand hygiene. First one would be hand hygiene before touching a patient, before clean or aseptic procedure, after body fluid risk, exposure risk, after touching a patient, and after touching patient surroundings. So all of these moments, you should make sure that you perform hand hygiene every after these moments. Okay, make sure. You need to make sure of that. 7 steps to hand hygiene. Okay, so these are the steps you need to perform for hand hygiene. If I'm not mistaken, uh, the timing for this should be, they usually do this while singing happy birthday. So once you finish happy birthday, then that's the time that you can finish also the hand hygiene or the hand washing. So first one would be palm to palm. Okay, you need to make sure that your palms are clean. Second would be back of the hands like this. All right. So the other hand as well. Fingers interlace. So like that. Or interlace. Okay. Fingers interlock like this. And then base of thumbs like this. Okay. The other hand like this. Fingernails. So fingernails like this. You can do this. So all the nail beds, anything that is inside the nail beds, can be removed. All right, like this. And then the wrist. Okay. And you perform hand hygiene like this, hand washing. So while the water's flowing, can go like this. So septic. And then do not do like this. Do not shake your hands. It's either you pat them dry with a tissue or air dry. Just do like this. Or some, yeah, either pat dry or air dry. Pat dry with the tissue. Do not do like this. Wiggle, do not wiggle your hands, okay? All of the water will scatter within the floor or within your area. All right. So that's it. Actually, it's a short discussion for infection prevention, um, infection control and prevention. We will have another set of training like this as we go along, as you perform your task along the way in this hospital. Um, So any questions? Do you have any questions, guys? All right. Okay. So if you have further questions, I'm always available. You can message me. You can email me through our work email, and I'll be more than happy to assist you with any questions. Okay. So I hope you had a very meaningful day today as we discuss infection control and prevention. I hope you had a glimpse on how infection control and prevention is a pivotal or a vital aspect on making sure that patient and everyone else in the hospital um, would not incur or would not um, get any infections. Okay. Thank you so much, guys. See you on our next class. Have a great day. Bye bye.